and Luis Hernandez, our customer success manager. And obviously this call is getting recorded, so just a quick notice on that. Today's agenda, we'll see Luis take us through the why, how it works. Angie will provide a live demo, and we will have a Q&A at the end of the session. If you do have questions, feel free to put them in the chat. If we don't get around to answering your question, we will again come back to it at the end. And also, yeah, just a quick reminder again, this call is getting recorded. And Luis is going to take you through the why.
Hey guys, pleasure to be here today. I know some of you guys may know me, and I see some familiar names as well. So first up, we've got a preview of what LumaBot will look like, and Angie's going to take us through that here in a bit. But before we move on, I do want to just kind of highlight a couple things in the kind of why category. So, you know, LumaBot is designed to reduce inbound call volume, right? We're looking to make an omni-channel experience for patients. In other words, maybe digital front door for some of you folks, and get patients what they need much quicker. So, you know, to kind of expand on that idea, you know, you may be familiar with some larger healthcare shops or some larger enterprise organizations. You know, for them, it's kind of at the website level, right? You know, is there a provider search? Who can care for me? Are they close to me? Do they accept my insurance? Or are they able to treat my specialty? Am I able to schedule directly for the patient and the care that I'm looking for? So LumaBot is really kind of an extension of your EHR platform on your website that will allow a patient to, you know, select a provider for treatment by appointment type or symptom, you know, insight into the location and access to schedule within that provider's most recent availability. So again, it's just, I just want to emphasize here, you know, the convenience factor that we're going to be talking about, that a lot of big healthcare shops do not have within their website today. So just definitely want to point that out. So let's talk about the need here. So again, our overall goal is to provide information faster to each patient. So, you know, no waiting on hold, no wasting time for the front desk, and then just getting quicker access to scheduling, directions, all that good stuff. So that it's really kind of a two-way avenue here. So from a staff's perspective, you know, what I want to focus on is really kind of this reaction mode keyword. So, you know, potentially, you know, looking at, you know, what is the biggest issue? And I think a lot of us can relate to this. What is the biggest issue that I'm dealing with right now? Either patient related, internal related, and how is that impacting the entire patient population? Is there a ton of people on hold? Is there a ton of people waiting for me to move them on into their appointment? Whatever those actions may be, that's kind of one side of it. And on the patient side, it's having a difficult time connecting with that information. So is that going to lead to a bad experience? Having a lack of information, is that going to lead them to go and find care elsewhere? So our next slide, we're going to highlight the staff side. So again, I definitely want us to keep this reaction mode idea in our head. So these are all items that, you know, front desk staff members will you know, go through daily. So, you know, this causes a lot of congestion to complete their daily duties, and it becomes challenging. So these all translate into what is that experience for the patient look like? Internally, is everyone on the same page? Does everyone have a good understanding of that internal process that's going to take them from the intake process, actually scheduling them either for the next appointment, getting them into the appointment for care, whatever it may be? These are all items that need to be accounted for. Okay, and on the patient side, we're going to talk about some of the reasons why they actually need to get in contact with the office. So again, difficulty connecting to specific data points. So to relate to this, right, you can think of, you know, what is your experience, or how frustrating can it be to call your cable company, to call your mobile provider? When you call, how easy is it for you to even get connected with the appropriate department or person that you're trying to speak with? Is speaking to someone directly even an option? Is scheduling a service even an option? And from a clinical standpoint, we've really got to think about the patient experience here. So maybe they're anxious, maybe there's a bit of embarrassment for why they're calling. Maybe there's a certain appointment type that, maybe that's why they're putting off the care. They don't want to pick up the phone, talk to someone about that. Again, a level of anxiety there that we can eliminate by just digitizing this entire experience. And I do want to call out that through our research, it's really kind of how we populated these. So through our customers, we've actually came back with these being kind of the top reasons as to why a patient would actually call. So again, just ask yourself, within your own process, is it simple? Does it make sense? Okay, so we did share a poll right at the beginning of the meeting. And I believe we ended with kind of a split decision between waiting less than 2 minutes and then being okay waiting 2 to 5 minutes. I think it was about 38% for each of those. So we do have some industry standard metrics as well that we've kind of gathered to share with you guys. So on average, a person will spend a month and a half waiting on hold. 65% of adults will only want to wait 2 minutes. And of that, 1 out of 3 will actually never call back. So again, it's tying it all together, right? What is acceptable to you? More importantly, what is acceptable to your business, as this will directly impact patient feedback and the patient experience. Okay, now patients as consumers. So the idea of omni-channel accessibility is key. So, there's a couple examples that I want to take you through that I think we can all directly relate to. So this idea of chain reactions where we start on one device and it kind of leads to something else is really something that the patient experience is as a whole. So one example of that is, streaming, right? So if you're on Netflix, you can start on your TV, you can easily move that to your laptop in your bed or in your desk, whatever that may be. On a more personal level, in my household, we are smart everything, right? We don't have cable, we cut the cord, we've got smart TVs, we've got Alexa and controls our entire house. But I think the one that really kind of called to me was with my kids specifically. So we obviously have a lot of digital subscriptions. An example of that would be Disney Plus, right? They'll watch TV, we'll pause it in the morning, and we actually have an iPad in our SUV. They can easily just pick right back up where they were and start that, right? And it eases the mood, right? No fighting on the way to school or picking them up or on a road trip. So again, chain reaction and convenience. So number one, the ability to either do Netflix or Disney Plus and the amount of devices that you can connect to that made that a very simple decision for me to invest in. That led to me getting an iPad specifically for an SUV. That led to me getting hotspot service for our car, so we didn't have to depend on the hotspot on my phone. So again, convenience. So from a patient perspective, I have a large family. I have a family of 6. I've got 4 kids. If I have to pick up the phone and schedule individual appointments for 4 of my kids, that's not something I'm looking forward to. And as a whole, as a family, we do it in bulk rather than going to appointments at different times of the, let's say I don't want to do 4 separate appointments. I want to just knock them out in one. And again, I don't want to make that complicated. So if there's a way for me to make that easier and through a online form of a website or through some type of app, that's going to be the way I go, just based off of my own personal experience. So again, ask yourself, what is that patient experience? Is it at this level of convenience? And is that something that you have today within your organization? And then with this, I will hand it off to Angie.
Cool, thanks, Luis. I'm going to walk through a little bits about how LumaBot works, what's the offering today, and then we'll walk through the demo in a little bit. All right, so how it works. Out of the box, our base solution packaging is built so that You don't have to have other licenses in Luma in order to use LumaBot as a standalone. That said, everything is built on top of our existing infrastructure for LumaBot. And we know we're not a chatbot company. We are a platform company that now offers a bot. So all the things that you already do and love in Luma, we're just creating a new vehicle that you can kind of route the power of the platform behind. So the way we like to think about it is like LumaBot is your mobile phone, and Luma Health, the platform, is like your laptop, your desktop computer. So data syncing back and forth, you can do all the things, but it's in this like bite-sized version that's easy to access at any point wherever you are. And even for us, like when we went out to build LumaBot, we know we're not first to market with a chatbot. So everything that we did in our design philosophy and the use cases and the stories that we're trying to build out, we're keeping top of mind all the things people find frustrating about chatbots today, like getting stuck in loops, not being able to connect to an actual human, and the bot not understanding what you're saying. There's no exit strategy. So keeping those things top of mind will kind of highlight all the things that LumaBot does. But again, back to this out of the box experience. So what we're including in here is a scheduling request. This doesn't need to tie to a PS Plus flow or your scheduler. If you don't want to, it can be an online scheduler. So this is supported across all EHRs. The second bit is COVID-19 screening. This could include other types of screening as well, but out of the box with standardized like the CDC screening form that you can put onto your website. And the bottom three here, we're bucketing this under this umbrella called patient triage, which basically means like any type of workflow or action that you would need to route to a staff member or have some other action there. So for example, speaking with staff, asking a nurse a question, maybe it's an RX refill, or I've seen really cool use cases on like ordering contact lens prescriptions. So that could really be anything. And then the bottom two down below are like session timeout and feedback, which we'll walk through in a bit of like core flows. These are things that are needed in order for patients to have a successful experience, for us to track the information, and for your bot to work appropriately. And on the custom side, this is an ongoing list for us. As new use cases come up, we'll continue to build this. But we have things like keyword actions and automation. So if you guys are familiar with Luma Health's custom actions, this is following that same infrastructure, following the same rules. It's just in a new format in the bot. So you can have things like auto responses or automations built off of a patient's keyword or input, like they said directions. And then we have a series of actions that could happen after that. And then down below are things that are customized and we're in the works for them in the near future. This is like a Q2 deadline for us. So things like a symptom checker that could lead to scheduling an appointment where a patient can go through a series of questions. We can save all of that data and leave it in with that appointment information. So everyone on your team, the provider, has everything that they filled out here. Things like site navigation. If you've put in tons of work into making your site have all the information patients need, oftentimes they get there and they can't find what they're looking for. So you can have an assistant that helps them kind of guide through your site as well. And even live chat. So this is new for us, but the infrastructure is there based off of like our collaboration hub and patient chat that exists today, but a way for people to connect with a live agent directly from that chat, which could potentially even lead to like asynchronous care, a chat with a provider, a telehealth appointment perhaps. So this is ongoing. The more use cases that come up, this will continue to grow. So when we talk to customers, especially during like this early access program, the first question I always ask is like, what are the top 5 reasons patients are calling today? And then we workshop that out. So this could be a custom flow, an existing flow, but our goal is really to get patients what they need wherever they might be. And I see some questions in the chat we'll go through towards the end. So continue to put them in there and we'll log them up. All right, so this is a preview of our chat flow builder. I'll show you what it looks like in an actual Luma Health account. If you have Forms or PS Plus, you're already familiar with what this is. So this is built on top of our existing Forms infrastructure. So we're just switching the way that we're delivering that form into a chat flow of a conversation rather than like clicking through a page or clicking through a document. So you'll see at the top, these are your core flows. This is what has to be built into your account in order for LumaBot to work. So things like your welcome message, how you want to route to your staff. You can disable these if, for example, you maybe don't want patients to connect with staff. You only want them to be self-service on the bot. That said, these are built in, they're hard-coded, and this is what kind of makes all these conversation flows go all the way to the end. Things like a session timeout. We really want to protect patient privacy. So we have tickers there to make sure, like, do we have them? Do they have what they need? If not, let's protect their privacy. Ending the conversation. And my favorite is the feedback, which we'll walk through in a sec, but it really highlights, did we handle the conversation or not? far less about like, were they happy about the experience? That's always a win too, but we're more concerned about getting patients to action rather than just talking through whatever they might need and then having them have to pick up the phone and call you. And then down below, we see these additional flows. So this is kind of anything else that maybe you want to build out into your conversation. So COVID-19 screening might be patient intake, lab results, any type of workflow that we could handle into the bot itself. And on the setup and configuration side, like all the work and effort that you and your marketing teams put into your websites, we want to make sure the bot has the same look and feel. So even with our design philosophy of building this out, we really didn't want to keep like healthcare bots as our limit here. We were looking at consumer products. We looked at every classic chatbot that's in the market that we might engage with. So your, like Luis mentioned, your mobile provider, your internet provider, Amazon was a big one. We even looked at like really consumer focused ones like HubSpot and Drift. So like we looked at every chatbot and figured out what type of UI, UX would really enlight and engage patients and want them to use it and interact with it and doesn't feel like they're going to end up in a dead end. And so here you can see you can fully customize the bot however you see fit. I've found that health systems kind of fit into two houses, as I like to call them. So the first house is like they want their bot to feel like an assistant. So they name it Sandy or Mandy and they say to their patients, go talk to Mandy on my website if you have any questions. The second house, they want them to feel really like a bot. So they want it to be very clear that they're not talking to a human. They're not talking to somebody like a human. This is a bot that might help you get to what you need. And so depending on whatever house you fit into, you can customize the bot however you see fit. So uploading an image, we put a standard bot in there for now, but I've seen people put an actual person there, somebody who looks like a human. They have had their logo in there instead. So whatever direction you want to go to, we want to fit that brand and the messaging that you want on your website. You can name your bot. You can make it something bot-like or human, however you see fit again. And then the title, the color of that header to match your branding, the welcome message, the language that goes around it. And then there's a quick embed code that you can copy and paste and throw onto your website really easily. And if you want to preview that ahead of time, on the right side, you see this preview LumaBot tool where you just put in the URL of your actual website and you can generate a little preview. And I'll show you what that looks like in the demo. But this is a great way to keep validating and seeing if this is the exact image that you want to put on your website before having to actually make any changes. All right, I'll highlight some key demo-y type things, and then I'll go through the live bit. So here, as Louis said, this is like a sample of what your bot could look like on your website, matching all the experiences, the sizing, etc. And the bits that this does is I'll walk through like a zoomed view of a specific workflow. So on the left side here, what you'd see here is like your header, all your branding, and then that welcome message that we mentioned. And then down below, these are your individual chat flows that now are built into this conversation. So each of these are unique chat flows like booking an appointment, screening, RX refill, speak with staff, etc. So zooming into like the book an appointment flow, as I mentioned before, we kept top of mind all the things people find frustrating about bots today. And one of those key points was that like people don't like to go through multiple doors to get what they need. They're already on the bot. We shouldn't have to link them out to different pages on a site or different apps in order for them to get to that end state. So in some cases though, like Epic, let's say, all roads kind of lead to Epic. So that's totally okay. We can build the bot in a way where it leads to one kind of source of truth, and we could still have a catch-all for maybe people who don't want to, or we can continue to do everything through there. On the flip side of that, where people want to have this engagement go directly through one door at all times, kind of open them all open at once, we want to keep everything within the bot itself. They're already here. Why take them out of the experience? Every new step is like added friction into their end state. So what you see here is like our mini widget of our scheduler. This is all tied into your existing scheduler workflows, all the rules, all the questions. You can ask and verify them ahead of time, and then they can select the appointment that works best for them. And then they get that confirmation within the bot itself. So each of these flows, they're really going through end to end, depending on whatever action that they're trying to do here. And if they can't get to that action, we route them to the right place, the right team. We can triage to the right group in order to prevent like ongoing incoming calls or voicemails that maybe the patient doesn't have validation of like what's going to happen next after that. Also, you have all of the information that they put on here. Like we've heard feedback time and time again that like patients will leave voicemails and not give you all the information that you need in order to follow up and have everything without having them kind of tell you their story over and over again. So in this case, you can actually guide the patient in a flow that makes sure that you have all of the information you need, and then we can follow up with them in the contact method and the time of day, et cetera, that they actually want to get contacted back from. So we're not chasing people back and forth, and there are no dead ends here. All right, so highlights of what our bot does. So patient verification. Anyone on this call who has any type of scheduling in their account, you know, we do this day in, day out. This is our bread and butter. So we don't have an app. We don't have a portal of logins that they need to log in with. It's just their key information that they already have. First, last name, date of birth, and at least one contact number. And we do a quick 2FA. And this makes sure that we know who the patient is, and then we can change the flow accordingly, or we don't know who the patient is and we can change that flow accordingly. If you have rules in place that maybe say like no new patients can book through the bot, we can do this check immediately and guide them into a different flow if needed. So in an instant, as soon as they verify themselves, we're checking your EHR and checking Luma Health to see whether the patient exists or not, and then creating a new one. Also, this also prevents us from like merging bad data. Like you're the source of truth, not us. So if a patient maybe got married and changed their name, or maybe they put their nickname in here instead, we're not scrambling to try and merge the patient. We're giving you a new record and you can merge it accordingly and giving you the tools to do so. But every step of the way, we want to make sure that we know who the patient is or not, and then giving you the tools to kind of mitigate that if you need to. And then on the right side here, you'll see patient triage. So our goal here is like LumaBot means no dead ends. That's like our key here. So not only are we heavy duty on this patient triage flow and automations, routing these paths to the right place, no one's going down a phone tree and leaving a voicemail in the wrong place. Based on this conversation and inputs, we can guide them into the right directions, and then we can queue this up for you at a later time. So you're no longer scrambling in reaction mode. Your team can now respond to these messages in your time rather than the other way around. So like if it's an inbox, like in your hub, you don't have to drop whatever you're doing right now to answer that chat. You can do that whenever you have time throughout the day. And we can set up the expectation with the patient. Like for example, hey, it usually takes us 3 to 6 hours to respond, or we respond within 24 hours. Then the patient knows what's going on and they're not kind of just sitting in a dead end waiting for somebody to call back. And then here we see the feedback collection. This is actually my favorite bit of this. It seems really tiny, but this really guarantees like, are we helping the patient or not? I think some people may disagree with me, but I was very much against like the smiley faces. Like, how did you like our bot? How did you like Mandy on here? Because that only takes you so far. If somebody was really nice to them over the bot, but if you didn't get what you needed, is that actually helpful or not? So for us, we're really competing with like your phone handle rate. So things like in your phone system, you might have like a percentage of calls that you actually answered and the calls that you handled. So competing with that, our bot should be able to handle more things than maybe a phone, because no one's waiting on hold. There could be thousands of patients engaging with your bot exactly at the same time. And so that percentage of just no longer waiting, no one's hanging up, that number should go up. And so again, no longer really caring about, we do care, of course. Like, I think it's great if they were happy with the experience as well, but far more concerned about, did they get the action that they needed? Did they get the help that they needed? And then top of mind for us is safety and security. We have an emergency banner at the top. You can also embed this in different parts of the message, depending on other responses that they gave ahead of time. But like, this is a bot. The patient needs to know 1000% that if this is an emergency, they should pick up the phone and call 911 immediately. So you can put this message initially in that first message, and then also embed it into different parts of the conversation. If we define like, maybe this is a bit of a risk, like COVID screening, for example, there are some areas of that screening form where we determine that they're high risk. The immediate message that we send back is like, hey, this sounds like an emergency, you should call 911. And then removing everything that the patient put in there if some time has passed. Since this is on a website, it could be open on their computer, just like our EHRs and everything else. Depending on the time frame that you set for your account, we typically put it at 10 minutes, but we'll start a clicker as soon as we haven't had any activity from that patient. We have alerts and kind of tab alerts that come up in their browser as well, but just in case they missed it, we want to clear everything else that's been in the chat if a certain amount of time has passed, since they are providing information like their first name, last name, date of birth, contact number. It might be some symptoms that they're experiencing, their appointment details. So we want to protect that as tightly as possible to prevent anyone kind of picking up and seeing all that information. All right, I'm going to go through a demo. So I'll kind of highlight the bits that we showed today. Let me open this up. All right. One second. I'm going to open up a new one. I'm just putting some test information in here for now, and I'll show you what that bot looks like. So here, I just put this on the Luma Health website as a sample, just to give you an idea. This can go on any website as it stands. So you'll see here, this is your little welcome message, fully customizable bot image as well. And then you'll see here, title at the top here. You can restart the conversation. You can speak with staff and change the language at any time. So this is where I like to put, like, there's an exit strategy. There's help immediately. You don't have to like engage with the bot in order to get the help that you need. This can happen at any point at any time. And so here I'll walk through like the booking and appointment flow for now. We'll see here, we're going to get some information. I'll put in mine. And this is our typical kind of verification flow that we always do today. It's just in a different bot form. Right, sending myself the code. Sorry, my internet is a little bit slow here, so we can say that. And so here we can see some guided information. So we can ask the patient some questions about what kind of appointment that they're looking for. This can be anything to like prevent them from booking an appointment they're not supposed to, or just gathering information. So this can say anything. I'm just gonna kind of go through the flow here. I'm gonna say migraines. And then here you'll see our little widget pop open where you can book an appointment immediately. I'm going to select one. You can also carousel left and right if some availabilities don't work for you. If none of these times work, they can always click this open to see our full scheduler where there are filters that you can apply. But for the most part, most people should be able to find their appointment this way. I'll book my slot. And then I get a confirmation here. And the reason this is pending is in this second, we're doing that verification back and forth with the EHR. We want to make sure that spot's still available. No one's booked it in that time. And then the patient gets a message back or a call back, depending on the contact number that they provided, whether that appointment's been successfully booked or not. Then here, can I help you with anything else? I'll say no. Before I go, did I get what I needed? Yes, booked my appointment. Great. And at any point, I can start a new conversation here. So when I click there, we start from the beginning again. And then I'll go through what our demo portal looks like. And so here in our little test account, we go to mission control. I'll go through the builder itself. And so here, again, very similar to the forms builder as it stands today. These are our core flows. You'll see some really cool jump activity that I find very exciting. So now here, we can link the forms together. So essentially a patient's going through an entire chat conversation, but they're actually jumping through multiple forms, but they don't know that. No one needs to know that. And then we store that all information all at once. So here you can see, like, this is that welcome message that you saw. Hello, I'm the virtual assistant. How can I help you today? These are the individual buttons that we present in that first message. And then here in the jump logic, it jumps to a different form. So any type of flow or form that you've built out, it can jump to that instead. And you can do this in any part of the flow at any form. So you're kind of routing through different loops depending on patients' responses here. And then down below, you're seeing things like booking an appointment. So you'll see some crazy jump logic. This is to prevent the patient from having to give you their information again. So some of these flows like intake or booking an appointment, we're always going to ask for verification, like your first, last name, date of birth, and the phone number. But if you've already booked the appointment and then we link you to an intake form, we shouldn't have to ask you all of your information again. So these are some logic that's in place. So if you've already verified yourself once, you can go through as many different flows as you want to, and we'll store that information all into that one conversation. We just don't want people to get frustrated and having to like act like we don't know them. And when we do. So here's an example of all the different questions that you can add, very same to PS Plus or your intake forms today. And then we have this little widget here to kind of book through your appointment details. All right, and then I'll walk through the builder itself, which we showed in the demo highlights. So here we can see the little preview. I can upload an image. I can change the name of the bot, change any information, change the color based on your branding. There are other features that we want to add on here as time passes, like things like, do we want it on the right side or the left side of the screen? Maybe the sizing of the bot. So this is our first iteration of this. So as more requests come in or as more different use cases come in, our team is fully ready to kind of support this and grow this with you. We really want to partner with our customers on this to really make this the best experience, not only for our customers, but for our patients as well. So here you can see in real time the updates that happen. Any change that you make here, you'll see directly over here. And I know we have a ton of questions, so I want to make sure we get to that. Oh my goodness. All right. I think, Nathan, if you have the space to kind of drive the questions.
Yeah, Thank you, Louise and Angie. Sorry about that. So yeah, we do have quite a few questions to go through. And again, thank you for posing those, and keep them coming if you want them answering. So Angie, our first question is, so out of the box is included, custom is additional. I think just clarifying what that means would be great. So
yeah, so right now the out of the box is included within the chatbot package. Just to confirm, like, you have to talk to your CSM, and an account manager will connect with you. We'll get to the details of how to get connected and sign up for LumaBot, but it will be a new contract since it isn't following our existing kind of solution packaging as it stands today. But we'll go through details on how to sign up or how to get a demo and get connected.
Great, thanks, Angie. The next question is, when scheduling, does Luma understand who the patient's provider is, so that they don't schedule with the wrong provider?
Sure. So we can do that. I mean, if it's rescheduling an appointment, we can ask them. We can always ask them their provider. We can get their information. But on online scheduling today, they usually select their provider or answer a series of questions, and then we lock them into a number of availabilities based on the answers that they gave us.
Great. Thanks, Angie. If they ask to speak to a nurse, can you push them to the patient portal?
Yes, we can always push them to the patient portal. This comes up a lot. It's like, hey, is this bot meant to replace the patient portal? And that's not the case. In some cases, if you don't have a portal, we can treat this as a portal, but oftentimes we will link to a portal itself. And we can also help with troubleshooting with the patient portal. If there's any like FAQs, how to reset your password. I know things like that come up a lot in the call centers and just at the front desk. So like anything with just asking a nurse a question, getting other information that you already have in your portal, we can always drive patients into a path that already exists for you.
Awesome. Next question. Can they be served the link to the online scheduler with the out of box option?
No, but if you already have scheduler license, that's a conversation that we can have with your account manager.
Great. Can we have different departments answer depending on the patient needs? We have multiple departments that handle different patient requests.
Yes, so that's the exciting part. Like, depending on how your account is configured in Luma Health, we have user groups, and oftentimes these user groups are made up of departments or different areas of your team. So depending on patients' responses, we can actually automatically assign to a specific group. Like maybe it's your finance question, it's all about billing, then we can automatically assign that to your like billing department. If it's scheduling, we can refer them to there as well.
Thanks, Angie. If someone wants to if someone wants to request a refill, does it just alert the staff via Luma, or does it integrate with the EMR in any way?
Today, most of the patient triage stuff will route to staff in Luma, where you can go ahead and respond that way. But in the future, I think we're continuing to build integrations on here. So that's something we're interested in looking into.
How does it know if the patient is new or existing? If new, will it create an account for the patient?
Yep. So that's our patient verification flow. When we ask them for their first name, last name, date of birth, those are typically unique identifiers, but sometimes there are patients with that same first, last name, and date of birth. So we also ask for one contact number, and that's the contact number that is in your EHR. It's their active number in Luma, and that's where we send the verification code. And so if it's not that number, whatever, we'll create that new patient for you, just so we're not merging patients that shouldn't be together. We want to be extra sensitive here since the source of truth is your EHR. But when we do have that accurately, then we know it's them for sure. They verified it accordingly, and then we can merge them, provide other information that they've given us.
Can documents be attached from patients or to patients with this chat?
Yeah, so that's on our roadmap right now. That's something we can easily add. It just wasn't included in our first iteration, but as you've seen, it already exists in Hub today. So that's something, if it is part of your workflow, we can definitely talk about.
Great. We've got a question from Michael. Does Luma function also act as a CSR platform, such as capture new patient demographics, interests, and push into EMR? Can they submit records or insurance card and push to EMR?
So I think that's more of like a forms question rather than for the bot, since the bot is built off of all of our existing infrastructure. But our forms team, if you connect with Steven, they're working on that right now. We do CCDA pushback today, and there are a lot of bits where we're pushing a lot of this data back. So we can connect you with the right team to talk through that.
Thanks, Angie. A question from Genevieve. Scheduler doesn't work for us because of our appointment setup. We have to use forms for scheduling. Would we be able to route it to our website or to the Luma form?
Yeah, so we can do this in multiple ways. I've kind of seen it in two ways. Some people want to keep their scheduling as a form on their website and then route through the chatbot to that form. I've also seen customers want to have both experiences. So you might have that exact scheduling form in the bot itself and have a link on your website. So it kind of allows patients whichever one they want to do, they can, whichever one they feel more comfortable with. So it can go either way. We can link to whatever existing flow you already have, or we can even build whatever flow you have within the bot as well, because the outcome for you will be exactly the same. It's a completed form, just as you're probably getting today.
Thanks, Angie. Another question. What happens when a child's number is associated to mom/dad's number?
Yeah, typically it's mom or dad's number already as their primary contact, as we've seen today. But in the scheduling form itself, you can even ask like, hey, is this appointment for you or for someone else? So we can kind of collect the right data rather than collecting mom's information rather than the child's information, or vice versa.
Great. A question from Bruce. Can you reply with a video that will come across to the patient like an SMS message, trying to avoid sending just a URL that the patient would have to click on to view the video?
Not today. We haven't really seen that. And sometimes videos can be very, very large. And so we usually see them in a link, whether it's YouTube or something else, but I think that's something we can talk through. If the use case is something that's very specific to you, I'm like always open for new ideas.
Question from Kyle. How will this impact the performance of my website, such as page load speed?
Shouldn't impact it at all. We've done thorough testing and our team has as well. It really depends on how your website loads already, because we're loading just a tiny, tiny, tiny iframe on top of that. So if your website already loads slow, the bot will load slow. But if everything's going on instantly, like we've seen it go pretty well. There's tons of JavaScript already on your site. It already is kind of taking bits to load. Then our bot kind of takes a minute as well.
And we get a question from Brittany. Which languages are available?
Yep. So right now we're supporting English, Spanish, and Portuguese because it's built on top of our patient app. Our patient app, those are the 3 languages that we support there, but we can have more as we go. I think our forms today as well only support those 3 out of the box. So again, LumaBot is built on top of everything already that was existing in Luma. So it didn't actually create anything like new. It just created all these new kind of channels into the bot itself. But we're always open to adding more languages too.
Thanks, Angie. Question from Patrick. Can people who are not yet patients use the chat and be spoken with in the hub?
Yes, we love this question because our team really built out like this huge mapping of how we identify patients. And so if we enable caller ID for your account, we can actually do a quick check when they enter in their phone number to get some information like their first or last name based on what's in caller ID if they don't exist in Luma yet. Or if we can't have caller ID, we maybe use their first or last name that they put into the form itself. And then our last round, maybe they didn't give us any information, they just gave us a contact number. Then we generate like a random name, like inbound chat, and it's like some random animal and color, I think. But there's all these different ways for us to differentiate like a brand new patient that came through the bot or through a text message rather than existing patients today. And it'll always say like inbound chat as the last name. So you can differentiate those within the hub.
Awesome. Another question. Can responses get pushed into the EHR? Yep.
So the unique part about chat flows is that it's both a form and a chat activity. So if you have forms write back, that'll write back. If you have chat write back to your EHR, this will get written back as well. So really depends on how your account is set up. So if you have like the 24-hour chat write back existing today, we can do that. If you have CCDA pushback, we can do that as well.
Great. We've got a question from Christina. Does this coincide with your online scheduling as far as the build out for appointments go?
Yep, everything is exactly the same. So if you had a PS Plus form already built out in your account, we can copy and paste that into a chat conversation instead. Typically, the questions are a little bit shorter and less because I think with the bot, we want them to get to that action very quickly, but it's up to you. We can really do exactly what it is. And all your settings, your configuration, your rules with scheduling will be exactly the same for the bot or your online scheduling.
Thanks, Angie. We've got another question. So since these are the same sort of as our scheduling plus, can you copy from the scheduler into the chat, or are you recreating the wheel for each form?
Nope, exactly right. We can just copy and paste that over so that you can have them in 2 different versions.
Awesome. A question from Tom. For pediatrics, can we change the questions to ask for the child's name rather than your name, etc.?
Yeah, yep. So we can always ask a question too of like, are you scheduling for yourself or someone else? Sometimes it's a child, sometimes it's their parent or something else. So you can always ask those things. The conversation is completely customizable. So these are just samples that we pulled out. You can really ask or say whatever you want in this flow, whatever information that you want. Everything is customizable.
Great. We've got a question from April. We currently use MedChat. If you are familiar with that platform, can you compare and contrast it with LumaBot?
I'm not as familiar with that, but we can look into it and we can schedule some time together.
Thanks, Angie. And I think Isabel might have missed a previous question that we answered, but we'll go for it again. Can documents be attached from patients or to patients with this chat?
So not right now, but it's directly on our roadmap. That's just something that didn't make the cut for our first iteration. But if this is specific to your workflow, something that we can easily add depending on that flow.
Great. We've got a question from Michael. Is there a way that a message can be texted to a staff member's cell phone if no one answers from a contact staff option from the bot?
I'm trying to make sure I answer this correctly. So yes and no. I mean, we have automations that could do things like that. We have a contact staff option with our automations and our custom actions. It's more so how are they going to respond directly from there, because today we don't allow staff to respond from their phone into the bot itself. But interesting use case, like again, I'm always all for any idea and willing to talk through them because I find all of these exciting.
Great, and we've got, looks like one final question from Patrick. Can we hard code the chatbot to start in English or Spanish from the get-go based on URL?
I mean, that's not available right now, but again, something that we can easily add in if we wanted to, depending on the workflow. But a quick workaround there might be your first question might be to have them select their language before they even start. And that could be an easy way to just do that now.
Great, we've got more questions coming in right now. Question from David. Can LumaBot be embedded into MyChat directly inside the sign-in wall?
Yeah, this one's exciting. I mean, this is what we're talking about actively right now and figuring out a path there. This has been coming up more and more. We've just launched this at HIMSS and Vive in the last couple of weeks. And so this has been a big question for us over and over again. And we're actively looking into this right now. And that's the goal. I think it would work really well there. And then, all right, I'll just read through these, Nathan, don't worry about that. Just because I think we're at time. All right, how long do you anticipate until this can be put into use? Will there be support available from Luma staff when that process begins? This is already available now. Implementations start April 1st. We launched 2 weeks ago, so this is ready to go. And Luma staff will definitely be on board. Like I will be doing the implementations myself, tag team with Luis in the immediate run. And then we'll have a support team. My entire engineering pod and product design pod will be available for this as well. And we're looking into 5.9. Do you integrate with any contact centers? Not right now. We're still only integrating with EHRs and EMRs today. But something, again, we're open to conversation because this chatbot is opening up a lot more use cases than what we originally do within the platform. So I think there's a lot more opportunity for different flows based off of what you guys are doing today. Yes, that you need an additional contract with this. And so next, that's a perfect segue to our next slide here. So if you're interested in signing up for LumaBot, this will take you into a demo form. It's also in the chat if you want to store those links immediately right now. And then if you need more information on LumaBot, there's the help center here as well.
Thank you, Angie. And I think we're at time for today. A big thanks to Louise and Angie again for taking us through that, and Angie answering the many questions. Again, you'll see in the chat that there is a link to the LumaBot demo. So please go ahead and sign up for that. We'll be staying on this link a little bit longer, so you can go and access that, or you can go and read more in the Help Center if you click on the article link in the chat. Hopefully it's been very useful. Again, super informative from Angie and Louise there. Please contact your CSM or a member of the sales team if you need more information or a future demo. But again, thank you for attending the office hours, and hopefully we can catch you soon. Thanks, everybody.